was getting a lot of B12. So he was getting D3 from the sun, he was getting a lot of B12 from the meat, and he used to come back before sunset because he cannot stay outside the cave because he himself will become a food for somebody. So then he comes back to the cave, and then once the sunset, there are no lights, it's pitch dark. So his melatonin used to get secreted, so he used to go to the sleep. So without any difficulty. So today what's happening? Exactly opposite is happening. So we are awake till 12 o'clock, 1 o'clock with a lot of blue light in front of us, and then we are getting up late in the morning, just straight away going to our offices. While traveling to the offices also, we are traveling in cars, buses, everything air conditioned, and we are fully covered. So those days the men used to be like half bed, and women also had a lot of those exposure. Women used to do a lot of work outside. So now the lifestyle has actually contributed to this problem to a great extent. Now that is why it's it was really a big surprise till these recent studies were conducted, that India and even Africa like continent, there is so much of vitamin D3 deficiency was seen. Okay, so this is the truth now. So we all need vitamin D3 and we all need vitamin B12, we all need iron. So these are three nutrients which are widely deficient. The large number of people who are deficient in this, in spite of so many programs and so many interventions, these deficiencies are not well controlled. So the government is also taking a lot of initiatives. A lot of products are available in the marketplace. In spite of that, the deficiency is still not getting controlled, is not coming down well. Is because the kind of supplements that we have in the marketplace are not good enough to solve this problem adequately, because there is some challenge with the formulations. Because our bodies are not made for absorbing vitamin D3 through the gut. Vitamin D3 is supposed to be getting synthesized through our skin. So when our bodies are not made for getting the vitamin D3 through the gut, and our foods also, most of our foods, Indian foods, do not contain much of the vitamin D3. So we have to take supplements. Then which kind of supplements we take? We have to take a supplement that works really. So that is where our picture, we come into the picture as a pharmaceutical company. So we understand the science and we develop the formulations with our scientific understanding, and we put years of research behind this. By using drug delivery technologies like nanopharmaceutical technology, we make these nutrients, micronutrients. Of course, we are a pharmaceutical company, we are working in various pharmaceutical therapies also, and in our portfolio we have these three nutrients, as Madam has correctly pointed out. All these three nutrients we are working, and vitamin D3 is one of such a product, which we could proudly claim that we have been able to commercialize this product, which is a patented product, and we hold the patent in all major countries across the globe, and we have been able to commercialize this product 6 years back, and today this product has been used by at least millions of people in the country. And okay, that's one part of the story as a company that we manufacture and we market. Then we have done so much work in terms of research and innovation in this space. Then we also feel it is our responsibility not just manufacture a product, develop and manufacture and put the product in the marketplace. We should actually really do a lot of awareness, a lot of understanding at the consumer level, at the patient level. So these are all, they cannot be even called the patients. They sometimes, the deficiency, they don't even know. They sometimes remain asymptomatic also for some time, but they are deficient. But only after some time they will land into some serious problems. So if that right intervention is, if they are aware, they are conscious of these deficiencies, how to correct these deficiencies. When they go to the doctor also, they discuss their problems. Many times they don't discuss. If today, for instance, sleep as a problem, they don't go and discuss with the doctors. Unless the doctor asks, are you getting good sleep? So not having good sleep is taken for granted. Okay, at least in my childhood, the doctors used to ask you to open your tongue and they used to check these eyes and all that. I think now the practice is not that common. Telemedicine. So now that it's not that common. So now these are the things people used to check those days. So now we are ignoring these facts. So now we thought that we must, take this initiative and partner with a responsible organization like FOGSI, who has got a wide reach. This is one of the biggest organizations who have large number of practitioners as their members. So we thought that we should be associated with them in making this reality, where we want to make India like D positive, not D negative. Okay, we are still, a lot of our population is D negative. So I think that's one of the ad which you must have seen, one of our, I think Mahesh Babu, okay, one of the milk fortified product, they talk about D positive. But then, let me tell you, I think that is also something that I want you to just give you those insights. What happens in India, the fortification of these micronutrients do not work so much because the way we use our milk and oils are different the way the Western world use. In the Western world, the people don't boil the milk, they just use them as a raw milk. And Western world, they don't use a lot of oils, for frying. So they use it in salads and all that. They take the oils like that. That is where, when these oils and the milk are fortified, it helps to a great extent. But in India, our lifestyle and our usage patterns are different. Therefore, the fortification may not help so much, because the moment you heat them to a particular level, so what you have added there as a micronutrient, it will no longer remain, because these micronutrients are very, very sensitive. Okay, they don't remain, they are heat sensitive. They will not survive there. So that's one of the challenges that we have. Though the intention of fortification is good, but there is a limitation there. So that is where I think the supplements still have to play a big role. And it's not just making good product, but it is educating the target audience is very, very important. And that is where we come into picture, and we take pride in the fact that we are one of the pioneering company in this space, and we own this space of, we want to make sure that, in fact, when I launched this product, my vision was that every dining table, the D3 should be there. Either our product or somebody's product, so that you need it, because you are anyway not getting exposed to sun. You need that as your daily routine. Okay, that's the kind of level it should go. But yes, it will take a lot of time, but it has to first go through the the doctor prescription, and then now I think the government is also considering bringing out these guidelines for fortification and all that. Definitely, we have to have a multi-pronged strategy for overcoming this. So thank you very much for your patient hearing, and if you have any specific questions, probably we could answer.
Yeah, I think that was a very lucid point. I liked it. What I want on the table is vitamin D and iron. Okay, so because I want to combat anemia also. And we are very happy that the past, from yesterday, we have had our meeting with FOGSI in collaboration with Science Integra, our partners, and the education partners Pulse. We thought that it's time that we have these practice points, which we bring out the important points, which would like our clinicians to be well versed, so that they can take care of the patient. So we have come out with the practice points of vitamin D in the necessity and how we use it, for example, in the low back pain, and for diabetes or for PCOS, for those particular clinical problems. So these practice points are actually very well taken of this TOG's Times of Gynecology with our education partner Science Integra, are very welcome among our members. People look forward for the consultant look forward for these practice points, because FOGSI as an organization, these are the small practice points which will help them in their day-to-day practice, and at the same time we do a lot of public awareness programs. So we make the public also aware about these issues and where we can take it forward. And now is the right time, I think. What has COVID taught us? There has been some I think the plus points with COVID, the point number one, the most important is we have realized that not only physical, we have the online connect. So now really the world has become a very small place, and there are no barriers. Sitting here, you can connect with anyone internationally and across the globe. At the same time, we have realized that we need to focus on the health, the immunity of people. So that's where all the supplementation of vitamins, micronutrients all have helped, because we know immunity is so very important to combat any disease. And the other important aspect which has been covered is the vaccination. I'm so very happy that the government and people world over have accepted vaccination. This is the right time for us to focus on vaccination also, the HPV vaccination, because cancer cervix is also one of the very big killers in our country. So there are these three aspects I'm sure will help us to combat diseases, like right from building up your immunity to having good vitamin D levels, to having a good iron so that your hemoglobin is good, so that anemia is less. At the same time, your screening and HPV vaccination, which will help your women from not getting cervical cancer. So these are the positive aspects, and government is also very keen. And this is the right time, I think. I think we shouldn't lose the opportunity, because everyone is receptive, right from a small child to anybody. I just walked into a shop to buy saris. So that about 6 last year, so he was the boy who shows, he's not the main person, he's that mid-level sales boy. So he's telling, they're all very close to me. He said, "Madam, I have to ask you." I said, "Yeah, I am in the Chapot. Which vaccine, madam, is Covaxin good, or is Sputnik good, or what is the Covishield good?" I said, "Why you are asking?" "There is not much evidence for this, and not much." I said, "You don't know the difference between a Banaras and silk or this thing, Gadwal saris, and you are talking about the vaccines." So that has been the level what COVID and media has done to our people. So I think this is a correct time where you take across the message back to the public how they need to invest on their health, so that I think the necessity for the other treatments will reduce, and we have a more healthier generation next. We shouldn't be asking our government to invest in hospitals. You want to have every alternate house to be an hospital. You want to have an ICU in every house. I don't agree. I do not accept that at all, because we don't need more ICUs, because pandemics are very rare, and let's hope we put this pandemic behind us. What we need is a healthy population. So that will be able to combat diseases. That will actually let us be looking at preventable diseases, and I think that is the best way forward, and that should be the best message which should be sent across to our people, and that's where your role will come in as the media partners to send across this message, and I'm sure Mr. Samar Ghosh and team will agree with me about this.
True, absolutely. So we are ready to take questions, from Dr. Santa Kumari and as well as Mr. Rao.
So out of 100, how many vitamin D deficiencies are there presently in India?
Statistics, some studies have shown about 50% to 70-80% prevalence. Difference. We don't have huge population-based studies, but a lot of studies are coming. We have a big, about 50 to 60, 70%, sometimes 82%, depends on that population, but it is very widely prevalent, almost to 50% and above.
So apart from the sunlight and taking the tablets directly, what are the other alternatives that we have for
There's no other, see we have still having the sunlight, but still we have a possibility of vitamin D deficiency because of our complexion. We have, and then the conversion is lesser in our dark skinned people. That's also one factor. Not only that, why are we talking about environmental health? Why are we talking about all this, the country sitting and talking about the G summits and all what? All the environmental pollution is actually creating the barriers. Even if you stand in the sun for few hours, you still may not be able to generate the required amount of vitamin D. So all these factors have to be looked in. So that could be the reason why maybe our generation before and the generation, if I look at my own mother and father, my mother still doesn't have a single white hair, because she's also a doctor, gynecologist. But that is probably that time their lifestyle, their food and all that. And when our lifestyle, our food and our environment, so many things have affected. So that is could be one of the very important factors in spite of having the sunlight. Probably we are deficient, and genetically we don't know. We probably, why is it that diabetes is so prevalent here? There could be epigenetic factors, genetic and epigenetic factors which are there in our population, which could be leading to these deficiencies which we don't sometimes probably find in the other Caucasian or other populations.
In fact, in last 2 days, it was extremely delighted, we are to demystify certain myths and realities. Because everybody we know about the vitamin D, and as your question rightly says that deficiency. So before deficiency also there insufficiency. So when we talk about, in the blood pressure, there is a borderline, and then you just get into the problems. So when the people become patient and just patient footfall takes place in a doctor's chamber, so how the supplement can becomes a therapeutic. If it is therapeutic, then India becomes a subcontinent. So what would be the real approach if it is in Northeast, a gynecologist is treating in the same ailment and which is getting aligned to a doctor who is doing in Hyderabad as well as in Mumbai. So the patient should not get deprived because there is no harmony into the approach as well as root as well as cause. So that is exactly in the last 2 days, they have all the eminent gynecologists with her, because I have seen, as long as the moment she took the chair, lot of alignments with on side. One thing is like that, cancer and other aspects, and another one is public health. So that has always helped and encouraged the companies like us to come and become a knowledge partner. Like for example, you said about sunlight, but in sunlight we came to know about there are UVB and UVA. So